colleagues, dear friends, I'm happy to welcome you. I'm Ludmila Vassilieva. I'm a neurologist professor and I work at the Research Center of the Ministry of Health of Russia, and I have my own private medical center and a wonderful academy of medical kinesiology and manual therapy. Why I'm telling you about that is because the time has come when we can speak about what's important for rehabilitation, for health improvement of the humans. And that's why I named my presentation Adaptation of the Human Body to the Electromagnetic Energy. Today the whole world is looking at holistic medicine, at holistic healthcare. Why holistic? Because it looks at the human body as a whole, including all organs and all systems, and it studies the adaptation of the human body to the environment, and it restores health and also enhances its development with alternative treatment methods. That's why the holistic medicine is very popular, and the applied kinesiology is one of its segments. As you know, classical medicine works with specific organs and its diseases. What it means is they study the reasons, the manifestations, and the diagnostics, and they remove all pathogenic factors. That is why the classical medicine studies the diseases and how they are removed, how they are treated. But health and disease are different things, because human health is something different than just the lack of diseases. This is the adaptation of the environment. It's not just important to restore the nervous system reflexes it's not just important to check and restore the reflexes in the idle state. It's very important that they work hard and they work right in the loaded state. If the patient feels pain when they bend their body, we need to check their nervous system in the state in which is needed in order for disease to emerge. So that's why for the holistic medicine, the disease is not the goal of treatment, but it's rather the marker of the disadaptation or adaptation of the environment. If there's adaptation, then the disease is not a problem. Holistic medicine looks at the human body as the whole, as the interactions between its organs and systems and the interlinks between them. What do we mean by exchange with the environment is the exchange with matter and energy and information. We have studied the matter well. There's a lot of diets and advice of what to eat or not to eat at all, or drinking, or how to drink or not to drink at all, and how matter is extracted into the environment. We have studied all that, and we know that pure water is the most important thing in matter. We know about exchange of information. This is mechanical information, the reaction to gravitational field and intellectual information, and there's a lot of gymnastics for the body and for the brain. The internet is full of gymnastics. If this is so, why we still see so many people who are sick? There are more and more people who are sick. Maybe we are not seeing something. We are certainly ignoring something. We are certainly omitting something, because there's also the exchange of energy, and this is also a component of health which is also very important. But what do we know about exchange of energy? We know that the sun is useful and that the telephone is bad. That's all. And that's why I would like to focus your attention on the electromagnetic state of the body and exchange with the environment, and how to make sure that our health, which is affected by electromagnetic fields, gets better as soon as possible. I opened the internet in order to look at the electromagnetics in medicine and physics and biology, and I saw there are a lot of disciplines that study electromagnetics, and there's a bioelectromagnetics that study physics and biology, and they study all options, all kinds of magnetic fields in the body and the environment and the relations between them. I will not speak about the electromagnetic fields. I will not speak about thermodynamics. I will not speak about the exchange with the environment, because we know when there's a current of energy, there's an electromagnetic field that's around of the matter, and it's also a material thing. And I want to say that we start with electricity, and we start with the human cells, which are also studied very well and which are shown in medical research. That's why when we speak about the exchange with the environment, we know that there should be two flows. One flow comes from the earth and up, and the other flow is the flow from the universe, the effect of the sun and the moon, and it also affects our body. When we speak about magnetic fields, we speak about two types of magnetic field. That's the exogenous magnetic field, and this includes the Earth's magnetic field and the anthropogenic magnetic field, and also there's the endogenous magnetic field that is made up in the human body. And it's very important to understand how it is made and how balanced these fields are with each other, and how we join the inner magnetic field and the external magnetic field in order to make sure that they enhance each other and amplify each other rather than impede with each other. I will show you this table. This is very beautiful. There are lots of names are shown at the bottom, and they have divided all electromagnetic fields into 5 parts. They include biocurrents and electrical cells and electrical particles, and there are sensors and all kinds of tools that record electromagnetic fields. There's a low-frequency electromagnetic field that ensure the conduction of the current through all kinds of fibers, and there's also electromagnetics that flow through the nerves. There's single contraction, titanic contraction, and it regulates electromagnetics at the level of nervous conductors. We know that the nervous system is the key system where all functions happen through electricity. That is why we have recorded electrocurrents from the nerves and from the muscles, and this system can also be disturbed. There can also be a problem with this system. There's a beautiful picture on electromagnetics of the bowels, and there's a membrane potential of various muscles of the bowels. Why I focus on that is because where there's electricity, where there's current, there's also always a magnetic field. Both the nerves and the internal organs and the muscles and the skeleton. There's a very interesting electrogastrogram where electrodes are placed on acupuncture points and the electromagnetic field is recorded. We know that the blood contains a lot of iron and iron-containing elements, because the red blood cells do not join together through iron, which ensures that there's a good flow of blood and a good perfusion. When there's not enough iron, when the blood does not have good electromagnetic properties, they clot together. Electromagnetic radiation can be recorded by all kinds of sensors. There are huge schemes where every acupuncture point can be checked, whether its electromagnetic resistance is higher or lower, and there are a lot of materials on the acupuncture points in the internet. There's also electromagnetic irradiation when there are applicators, and all bodies react to ultra-high frequency radiation. It was a discovery for me that the medicine does not do electrocardiogram, but magnetic encephalogram. And all magnetic fields are of interest to labs and the diagnostic institutes. They enable the researchers to study a human without interfering with the human body. The ultra-red radiation is another wavelength, and this is where the thermal scopes help. Each type of radiation requires its own method of diagnostics and evaluation, and that's why thermal scopes are used for infrared radiation measurement. And also gas discharge helps see special diagnosis. There are special sensors that can record visible radiation of the human body. Why I'm speaking about that is because humans are sources of their own electromagnetic fluctuations. They emit radiation, and all bodies form their own electromagnetic energy. I don't like schemes usually, I don't like diagrams, but this diagram is very beautiful. It shows vertically how different organs and different systems have their own frequency of electromagnetic fluctuations. They do not mix together, they amplify each other, but they never impede with each other. And that's why when all organs, such as the muscles of the heart and the rhythms of the brain, they work in balance. They work as an orchestra, where all organs and all systems work at their own frequency, which can be recorded and which can be specified and determined. Besides, it has been found that electromagnetic energy can be different. For example, on the front surface of the body, there are mostly positive ions, and there are mostly negative ions on the back, on the rear plane of the body. And there are mostly positive ions on the right hand, and there are mostly negative ions on the left hand. That's why we place our hand on a place where it hurts, because we expect that the electromagnetic field of the hand will help treat. And this is why maybe when something hurts, we place a hand on the place that hurts, and we know this helps. Why we do that is because we expect that the electromagnetic field on the hand will help us treat. There are machines that record electromagnetic field between the right and the left hand and assess whether the polarity is sufficient in order for humans to keep this magnetic field stable. I want to say a couple of words about Piotr Anokhin, who created functional systems. They are biodynamic, self-regulating structures where all components help the adaptation of human body. And the applied kinesiology has a system where everything becomes a single whole, including a tooth and an emotion and a vertebra and a meridian, and everything works using electricity. The body reacts to electromagnetic effects, to electromagnetic actions, and some ions go deeper into the organs and some of them dissipate on the surface. You can see various frequency of effect of action on this picture. Waves come and waves go. Waves leave our body. It has been statistically found that there's a specific reactivity of specific frequency of reactivity in the body. It was statistically determined that there are different frequencies of reactivity of electromagnetic waves, and the nervous system is at the top here. Then is the endocrine system, and it was statistically determined that there's a specific reactivity frequency of the electromagnetic waves, and the top is the nervous system. Then it is followed by endocrine and senses and the vessels, and then the bones and the respiratory system. That is why it's very important for us to find the types of interaction between the internal and external electromagnetic field in order to treat a patient rather than to cause disease, because the electromagnetic field can cause a diagnostic effect but can also cause a disease through electromagnetics. I want to say a couple of words about Dale Sheldon. He's an American chiropractor who studied applied kinesiology back in 1970 with Dr. Goodhart, and then he understood how important the electromagnetic field is. And he has detailed and improved his methodology of electromagnetics throughout all these years, and we are ready to present you this material. And his words that electromagnetics, or the Einstein's medicine, is based on the fact that the human body is a network of electromagnetic fields, and they're affected by emotions and nutrition and the environment. Why applied kinesiology is so important is because it offers a regional unique methods of diagnostics. That's the manual muscle testing and the methods of testing the body under load. that helps us evaluate how the body is adapted to electromagnetic field. And one of the factors is to check electromagnetics on the repolarization of the muscular cells. And I will show you when you will study the practical part, which signs show that the electromagnetic balance is off. Once you work, you have a headache. When you work, you get tired. There are some people who have an increased consumption of electromagnetic field, like this wonderful and handsome man. In order to understand how the humans react to the electromagnetic fields, we have some challenging types of equipment. This includes the watch you wear, the smartphone, and the mobile phones, and they help you see with the pain and with activation of the autonomic nervous system. We can see various types of reactions. For example, an organ is compromised or a system is compromised, or you see an inadequate response to your treatment. You prescribe a sedative drug and the person gets hypertonic, or you prescribe coffee and the person goes to sleep. Then the wrong flow of the current, especially this pertains to the meridians. The electromagnetic balance can be different. There can be an organic distortion or a generalized distortion. We can do a magnetic challenge, a magnet challenge of an organ. We can face a local pain in specific acupuncture points, and then a meridian which contains these pains does not work adequately. What I'm saying is not new, but what we're trying to do is to provide a scientific foundation. The clinics of psycho-emotional states includes fright or anger. If you look at people in the streets, you don't need to look at my pictures. You will see either aggression or fright, just two emotions all over the place, because humans lose the ability to recognize, to be mindful of themselves. And it's very important that there are a lot of people who are very weak. There is a lady who is 35 years old, and she complains about weakness, she complains about poor sleep, and about her feeling cold all the time. This balance between the internal and external electromagnetic field is the reason. Normally, if you have a mobile phone next to your ear, nothing will change. But if your body responds irrational, it's not the mobile phone that's to blame. It's not the watch that is to blame. It's the wrong intensiveness, intensity, and stability of the electromagnetic field. I can list a lot of clinical factors that can lead to a disbalance in the nervous system. So when we speak about pain, it's not important to understand the location of pain, but what leads to this pain. Is it the wrong conduction of the nerves, or is it the wrong function of the nervous plexus or the brain, or the wrong ionization? When we see a disorder in the composition of the electromagnetic field in a human, then there's a response similar to that of a fetus in the at the intrauterine period. This means that specific muscles contract, and people try to join these muscles together, and that's why we see the pectoralis minor and the iliosacral muscle and the iliopsoas and the femoral ductor and the TMJ. They all are spasmed together, they're all contracted together, and they the gait changes because the nervous system regresses, because the nervous system degrades. When the nervous system degrades from heterolateral walk to the homolateral step or to creeping, this is due to the aggressive action of the electromagnetic field. A lot is spoken about scoliosis, but scoliosis is very closely connected to all other systems, including the electromagnetic systems. I will show you how the muscle belly reacts. The membrane repolarizes, and the muscles becomes hypotonic, and the muscles next to it are also hypotonic, and they get shortened. I've shown you the picture with the red picture, and it's not important where the pain syndrome is localized, but it's important which muscle it originates from. And when the muscle gets shortened on one side, and then on the other side it gets weaker. Then if you look at this handsome man, on the one side of his face is asymmetric. It can be due to an asymmetry of the TMJ, which can lead to a deformity of the skull. We can say this is not a bad medicine, but we can also get a food for thought. When the nervous system degrades, the gait pattern, the step pattern breaks, the connection between the hand and the leg breaks, and the gait reflex changes. The acupuncture points, and they become painful in case of deficiencies of specific minerals and micronutrients. The acupuncture points do not need to become tender in case of deficiencies. This only happens when the field responds to the deficiency. That's why when there's some specific conductivity disorder, then it's then that the acupuncture points become painful or tender. We will find a time to palpate all the acupuncture points, and I will teach you to work with them. That's why when we start evaluating the electromagnetic disorders, we always start with the muscles. We see if the muscle can respond, if the membrane can respond. We check the coordination of the nervous system, the coordination of the hemispheres, how the person responds to sound or to calculation. And we always look at respiration and breath. I want to tell you once again, I want to persuade you that the electromagnetic field is very important for the muscles and for the nervous plexus and for the nervous conductor. But it's best to start with respiration, because the breath ensures the inflow of air, but it also ensures ionization. When there's a disbalance on the right and on the left, when we activate various ions in the body, and that's why you do not just breathe in air, but through ionization you purify the air and you provide energy for your body. This idea of ionization of air in the body was echoed by Chizhevsky. He created the Chizhevsky lamp. He showed that when the particles become charged, the ash and the dust and the smoke and the bacteria drift towards the walls. And when we speak about the respiratory system, it's not only lungs, it's not only the diaphragm, it's also the nose and it's also the lungs. And when we breathe in, we ionize our body. We include the positive charge through the right nostril and the negative charge through the left nostril. And the front plane of the right lung is charged positively and the rear plane is charged negatively, and vice versa in the left lung. This is because the endocrine system regulates the respiratory system, and that's why the positive ion is assimilated with the right half and the vice versa for the left half. So in order to restore the respiratory function, we need to restore the brain and the psycho-emotional state, and to ensure that the inspiration is correct and the lungs work correct and the tissues work correct. We are used to working on each system separately in a fragmented way, but we need to work on all of them all together. In order to inhale correctly, we need to be in the right psycho-emotional state. Our brain needs to function correctly. Both hemispheres need to work correctly, and we need to ensure the correct contractions of the lungs and to regulate the lungs correctly. So before ionization, we need to check how the person breathes, if the biomechanics is problematic, if the diaphragm does not work, if the chest does not work correctly. We can think about ionization. How do we need to think about that? We need to challenge this person and to see if you place a hand on one half of the nose and one nostril, what changes? And sometimes you will see a deformity of the nose. And very often you will see a hiatus hernia in this patient. You will never ignore this patient. You will always see that one shoulder is higher than the other, and one part of the diaphragm is higher and the other is lower. One part of the diaphragm is in the state of inhalation and the other is in the state of exhalation. And if you palpate, you will really feel this inhalation and exhalation on different sides of the chest. And the response will change on whether you place the hand on one nostril or the other nostril. If the response on the diaphragm responds on you placing a hand on one half of the nose, this is about the disorder of ionization. It's important to check the sides of the brain. You know that the left side is about logics and the right side is about intuition. How you check in ionization is first you test, then you close one nostril and you look at the response. Normally, it shouldn't change. Nothing should change on whether you breathe with one half of the nose or the other hand of the nose. If the response is different, then you have the problems with ionizations. Then you check the hemisphere, which is the culprit, through murmuring or through something else, and then you check the eye muscles. I will show that on a patient and we will see that better. I want to show that as one single system. When you look at ionization, it's not enough to look at the nostrils. It's not enough, and it's not enough to activate the breath. You also need to activate the eyes and the brains. You need testing, then you do the breath challenge, and then you check the eyes. And that's how you fix the patient. The patient breathes in through the nostril, that gives an effect. At the same time, the doctor taps the chest on the front and on the rear, and you do the challenge, and the eye looks into the side of the challenge, into the direction of the challenge. I will show that on the patient now. And this kind of sequence helps restore ionization in the human body. And the most important is, after the treatment, you need to do the breathing gymnastics. Dear friends, I would like to show you the practical use of electromagnetics in real life. We see Elena, which is a very beautiful lady. And I want to show that normally when the person has a normal electromagnetic balance, there are no disorders in this person. There are no problems. Can I see your watch and your mobile phone? I want to check how the ionization is in this young lady. I look at the magnet and I test the muscles. I look at the magnet challenge in this patient. Please press and press again. Very well. We have a normal repolarization as a response to the northern pole of the magnet. I want to see whether the breath affects. I want her to cover her nostril with a hand and only breathe in through the right nostril. Please breathe in, and everything is perfect. And everything is perfect here. I see no problems with the electromagnetism from the position of the ion system. Now breathe out, breathe in and breathe out. And the other nostril, please, and breathe in and breathe out. I have tested the exhalation and the inhalation on both sides. I see no disorders. And I look at how symmetrically the chest moves. I want to show the back, the even shoulders and even spatulas, and I want to see the volume of the chest. You can see that my hands move. Please breathe in and breathe out. Can you see that well? The shoulders are not involved in breathing. You can see that the shoulders are not involved. But what's the most important is that the diaphragm works during breathing. This, please show her stomach. Inhale and exhale. Everything works fine. The breath works symmetrically. I want to test this with a measuring tape, whether the breath is symmetrical through both nostrils. I look at the measuring tape. Everyone has a measuring tape at home, and please cover one nostril with your hand. And I'm looking. And please breathe in and look at the size and look at the length. Now uncover with the nostril. The length is absolutely the same. The breath with the right and the left nostril has no effect on the volume of breath, on the breadth of the chest, and this shows that my patient is in the normal ion state. I want to check the magnet challenges. I know that there's a magnetic reaction on the north pole of the magnet. Let's look at the watch on her body. This is a very modern watch. I look at the watch, no response, and this is a normal state of the body. Can you please turn on your mobile phone? In order for, yes, we have already turned it on. I look at the response to the phone. Please press. And the response to the phone is very sad. So there's no response to the magnetic field. There is no problem with the watch. And there's response to there is a reaction to the mobile phone. This shows that there's an increased electromagnetic resistance in this patient, but not in terms of the ion balance. We will test her again later, and now we see Polina. Polina is a wonderful, beautiful young lady, but there is not everything is fine with her. Some strange complaints. The first complaint is I never go anywhere outside of the Emirates because I get cold, she said. I always feel cold. I don't feel enough energy. I'm always tired. And she says that she's very old. And so this person feels tired all the time. She feels weak and she feels cold all the time. And the second complaint is correct? Yes, that's right. The second complaint is if you look at how she speaks, she does not use her breath. She only breathes with the right segment, with the upper segment of the lungs. There is also another problem, some kind of compression of the under the left spatula. Please, there is some kind of compression under the left spatula. I think my nerve is getting compressed. I have never treated. I was not treated. I noticed that when I was doing the downward dog posture in yoga. When I get a patient who complains about pain in the shoulder, I want to test for compression and I want to remove compression. So the patient says that there's a movement that triggers pain and there's a direction that triggers pain. There are very typical symptoms. I want to look at that neurologically, but I will not hurry. I want to assess all complaints together. Feeling cold and some kind of breath deficiency. There's a slight asymmetry if you look at the patient. If you look at the face, there's an asymmetry of the skeleton on the face. If you look at the shoulders, there's also some asymmetry. One shoulder is higher than the other. Can you see that well? If you look at her back, there's also some kind of drooping and some problems, some compression at this at the diaphragm level. I can palpate the hiatal hernia, but I cannot touch that. Before knowing about electromagnetics, I would start palpating her stomach. But now I think why this is happening, why this very young lady has this set of complaints. This is not normal. This shouldn't be like this. I want to see how she breathes. I want her to raise her arms. I want her to breathe in and to breathe out. And please do a close-up. Please look that her right arm moves and the left arm does not move. Please breathe in and out. Can you see that my right arm moves and my left arm does not move? So this means that she uses her right lung, but she does not use her left lung. I want to know why she has this problem with the shoulders. I place my hands on the shoulders and I look at how she involves the shoulders in her breath. Can you see how my arm goes up on one side? She does not move with the left lung on the sides. She does not expand. But she expands to the top. She expands upwards. She breathes with her shoulders. For some reason, her shoulders are overloaded, and you see the disbalance on the shoulders. Why you shouldn't look at the shoulder muscles immediately? You need to understand why she involves the trapezius, the upper portion of the trapezius in the breath. I want to know how this can be linked to electromagnetics, because if the patient does not get enough ions, if the patient does not get enough energy, then it's difficult to do something with this body, because these are deeper processes and more important processes. I want to know how sensitive she is towards the magnetic field. First of all, I check the northern pole of the magnet. Please press, and that's very good. I look at the watch. I want to test. They say the watch helps her become healthier. Look at how this helps. I want to check the pain. Wow, ouch. No pain. Oh yes, no, it's painful. Now I ask her to place the watch on her body, and I look. Is it painful? Oh yes, it's painful. Ouch, ouch, very painful. And I want to say once again, it's not the watch that is to blame. It's not the watch that is the culprit. It's the increased sensitivity towards the magnetic field. I look at Elena, I palpate her tissues, and then she takes the watch. She places the watch on her body, and no problem, nothing happens, absolutely nothing. This means that she has a normal response to the magnetic field. You're welcome. And as soon as I palpate the tissues, there is no pain here, but as soon as she places her watch on her body, there is a response immediately. Ouch, very painful, very, very painful. So if you feel strong pain, you should say ouch. Otherwise, the audience will not believe that you feel pain. Everything is on my face. Paulina uses her mobile phone a lot. How is it bad for her health? I look at the response of the muscles from the start. Wonderful response. One leg forward, the other leg backwards, and your hands forward, please. Close your eyes, please. And so she stands well. And now let's. I will ask her to turn on her mobile phone. Okay, fine. And place it next to your ear. And that's it. And that's it. Ouch. This means that she has a negative response to the telephone. I have invited this handsome young man. This is a very handsome young man. I test his muscles. Push, please. And I look at the response to the magnet. Please push. I look at the response to the watch. Please push. No response. And the mobile phone. Please push. Oh no. Oh no. Oh no. He says, I don't believe.
Tell me, I don't believe you.
Tell me I don't believe you. I palpate the intercostal muscles. Ouch, ouch. Is it ouch? Is it ouch? No, no. No problem at all. Yes, now take your mobile phone. And now this is ouch. Now this is an ouch. This is a big problem of our generation. We cannot understand that the muscles get stressed, the muscles get tense. We only feel that the breath volume is lower. When he breathes in, look how handsome he is. Breathe in, look how beautifully he breathes. Look how strong his breath is. Look how huge his chest is. Now the telephone, please. And breathe in, inhale. And inhale. And inhale. And that's it. And that's not all. Besides, we see a spasm in the diaphragm. Can you please take off your t-shirt? I don't want to undress you in public. When a man undresses in public, you shouldn't help, because otherwise you may not be able to stop. We palpate the diaphragm here, and everything is fine. Okay, no problem. Now he has a mobile phone in his hand. Ouch. Ouch. And please look, this happens only on one side, and very often there is an asymmetry of the diaphragm only because the patient holds a phone. And this is a big problem. We may ignore it, we may treat the patient, but we need to do something about it. This is a whole problem. Thank you.
Thank you.
Polina, please come here. Let's look at her. Let's try and fix her somehow, because she has the autonomic nervous system complaints. She has neurological complaints on the shoulders, and she has emotional complaints of fear and fatigue and some kind of bad feelings. I want her to breathe in with one nostril. I place on her nose. You can see that she breathed in with the left nostril. And what about the other nostril now? And everything is perfect here. Now let's do that once again. When she breathes in using her left nostril, see what happens. Her arm just drops. She becomes weak immediately. Do you feel pain? Oh, yes. Ouch. I'm not letting her go, and I ask the patient to change the nostril. You can see that she places her hand on the other nostril and covers the other nostril. Any pain here? Look at how her breath changes. Please focus on my hands and on the chest. First, you place your hand on the left nostril and breathe in. Are you going to breathe in at all? Breathe out. And now the other hand, inhale. The other nostril. And on the other nostril, inhale, inhale. Have you inhaled already? I have. And exhale. The other nostril, inhale. Can you see the difference? Dear colleagues, we may ignore electromagnetics. We may think it does not exist, but patients suffer because every time she has problems with electromagnetics and ion balance, in her body every time she breathes in, and also the mechanics of the lungs. And we can fix it using very easily accessible techniques. Let's try and do that. We found what causes her breath to not to work when she covers her right nostril. The left side of the nose assesses the ion balance somehow. I want to check how this is connected with the psychological state, because there are a lot of hidden emotions that we experienced in the childhood that reflect on the breath. That's for this we use the eye movement technique. I want her to breathe. I want the muscles the indicator muscle to become hypotonic or weak. I want her to look in in different directions. Look upwards, nothing changes. Look in this side, nothing changes. Look in different direction, and this is good now. I understand that you cannot test yourself. I understand that you cannot test yourself, but you can place your fingers on the suboccipital muscles right here, right under your occiput. And now move your eyes in one direction and now in the other direction. Can you see how the muscles contract? Can you feel how the muscles contract here? And when the patient has the response of the muscles, you can test on which side there's a problem with movement, because where the movement is not working well, the eyes then try to get involved and the head gets involved, not only the eyes move. So each time when the head is involved in eye movement, you see there's a problem on the side of deep psychological process. I will not go deep into that. I want to see how this response is connected. She has pressed that on her mouth. She's hypertonic here, she's weak, and now the direction on the other side, and there's a good response. I found how it works, and now I want to check how her right and left hemisphere work. And I know that the right hemisphere is about intuition. I want her to murmur some kind of songs like tra la 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 la. She murmurs fine, and I want her to count now. Let's calculate 50 minus 13 is 37. Let's go on. Now 24. As soon as she starts counting, her body gets weak. I want to join all three components together. I want you to breathe in. I want you to look right, and I want to count to yourself. Nose, eyes, and count. Press. Good. I have found three techniques that can be joined together. Once again, I found the side which causes her muscles to go weak. I found the movement of the eyes that makes her go strong. And I found the localization of the hemisphere that normalizes her. Let's look at her breathe now. Breathe in. Breathe in. Go deeper, deeper. Breathe out. You see her, what she does. You see that she stretches her neck and raises her chest. And I want you to raise my hand with your stomach. You know you're doing that with your chest. Do that with your stomach once again. And this is where you place your hands, and the other hand, do not breathe here. You only breathe with the stomach. Breathe in, breathe out. Inhale with your stomach and exhale with your stomach. Inhale with your stomach and exhale with your stomach. Now try to do that by yourself. Okay, let's practice and let's see what the reaction is. I have never seen this patient before, but let's look again. Let's place your hand on the nostril. I stand on the left. I'll do that with the other hand. You look left. and you count 1 to 100, adding 13 every time. Breathe in and breathe out. Inhale and exhale.
Вдохнули. И выдохнули.
Inhale
Животом.
and exhale. Please use your stomach. Breathe in and breathe out. And now try breathing in deeper. Please inhale deeper. And once again, deeper, deeper, deeper. I want to show how I do the tapping. I will stand on your side. Please breathe deeper and deeper and deeper. And now raise your chest and lower your chest, and now expand your ribs and contract them and expand and exhale. And now breathe with your stomach and breathe out again and again and again and in and in and in and once again. And do not forget to count.
И выдохнули. Вдохнули.
Inhale and exhale. Inhale and exhale. Inhale and
Я не
exhale.
знаю, что получилось. Давайте вместе проверим.
I don't know if I did any good. Let's check together.
Первое,
It's
что я делаю,
interesting,
я
isn't
проверю,
it?
как она дышит.
The first thing I do is I check how she breathes.
Хуже дыхание. Так,
Do you remember that her breath was worse on this side?
вдохнули.
Let's breathe in and breathe out. Let's inhale. Can you see the volume of breath now?
Смотрим, как плечи.
Breathe in and breathe out. Let's look at her shoulders.
Не надо уже ручку держать.
No,
Вдохнули.
don't hold your hand here now.
Вдохнули.
Inhale and exhale.
Выдохнули.
Inhale
Подышали
and
животом.
exhale.
Вдохнули.
Breathe with your stomach. Inhale and exhale.
Вдохнули.
Inhale and exhale.
Вдохнули.
Inhale,
Выдохнули.
inhale, and
Вдохнули.
exhale.
Видно, что
Inhale.
ноздри закрывайте.
Can you see that you covered the other nostril now? I don't see any difference between the sides. On the other side again.
Объем грудной клетки справа.
And I can feel that the volume of the chest on the right and on the left is sufficient. But what's important for me is
Я беру часы.
how sensitive she is to electromagnetic fluctuations now.
Подержите.
I look at the watch and I look at the response. Please hold the watch. Is it ouch, ouch? No. Is it ouch? Ouch, ouch? No.
Посмотрим,
Good.
можно ли любимому мужчине вам сегодня позвонить без проблем. без здоровья.
Let's see if your young man can call you without problems for your health tonight.
Ай-яй-яй-яй-яй.
Breathe in.
Что нет, ай-яй?
Any pain? Any pain? No pain? No ouch? No ouch at all? It can be.
Это поразительно. Но самое важное,
That's amazing.
же пищеводное отверстие
But
само
what's the
как
most
только
important
начала
is that the
дышать
hiatal hernia disappears as soon as the diaphragm starts breathing correctly. Because when she was asymmetric, one side of the diaphragm breathed well and the other did not breathe. And the breath changes. I will repeat the algorithm again. When the patient covers her right nostril and when she breathed with her left nostril, the response was inadequate. And this is what, and this is what I treat. I found that her muscles was getting weak in this case. Then I found the position of the eyes, which helps. Then I found the activation of the hemisphere that helps. And then I activated both lungs in order to balance the breath. So when she presses on her right nostril and you tap the front plane of the left lung and the rear plane of the right lung. But this has to be done at the same time, counting or murmuring and nostril, and at the maximum inhalation I tap the right and the left side of the chest, but I tap on both sides on different planes. And then I ask the patient to breathe with her stomach. Now her lungs breathe perfectly, and let's check the response further. You have to practice all the time. In order to do that, you need to see, you need to look at the volume of your breath. Can you see that the size is good? Can you see that the lungs move well? If you place a magnet on your body or you place a phone on your body when you lie face up, and when you feel that your movement is limited, or if you try breathing with one nostril and you look at your chest on one side and on the other side, and you find asymmetry, this means that you have problems with electromagnetics, and in particular with ionization. The side which limits your breath needs to be fixed. If you found that the right side limits the breath in the chest, you see which movement of the eyes, forward, left, right, backwards, diagonal, will help you improve the breath, and you fix the electromagnetic problems. Then you localize the right hemisphere with counting or with murmuring, and you find all factors and which improve your nervous system, which improve your respiratory system. When you find all factors together, you join all factors together, including breath and tapping where a colleague can help, and the eye movement synergy and the brain hemisphere activation. And you need to do that all the time. You need to get up in the morning and take a look at your lungs and breathe in. Do you breathe well? Yes, the breath is good. We cover her nostril and she breathes well. We cover her nostril again and the breath is not good, and you look again. If you turn the eyes left and upwards, do I breathe better? Yes, I breathe better, so I breathe with my eyes looking leftwards and upwards. And after that, I count as well, and I tap my chest. These movements, these techniques combine the lungs, the brain, ionization, and psychology. And this is one of the factors that help restore electromagnetism. And this will be your gymnastics, and this will help you warm up. This is a very simple technique. Dr. Sheldon Deal has a lot of them. If you want to do something in case of scoliosis and nervous plexus and problems of the refractory of reflexes and the Riddler zones, we will do all of this together with you. This is how, dear colleagues, I want to remind that we exchange matter, information, and energy. We have learned to exchange matter, we have learned to exchange information, and it's time to exchange energy. And it's important to understand not that the environment is aggressive, but rather how we perceive it. Is ionization well? Do our organs work well? Does the conduction system work well? And there's a huge body of algorithms and techniques of applied technology which helps you restore electromagnetics. It will not restore everything, but it will restore the right electromagnetic response of your organs and your body. And I want to say once again, do not forget, please, that in order to be healthy, we exchange energy, matter, and information. We know how to exchange matter. We eat and we extract the content. We do information, we exchange information, we do gymnastics for the body and the brain, but we do not do electromagnetic exercises. We do not restore our electromagnetic field. And that's why we fear the external electromagnetic field. If our internal electromagnetic field is fine, we are fine. We have no fear. And we will be happy to welcome you at our training seminars.
Thank you everybody who joined us during this period of time. And I hope you understand that we have devices as BioWell which can detect energy, which can detect energy of water, energy of space, energy of human. And this is device which is absolutely unusual for modern medicine and absolutely useful for holistic medicine. The device which can support us to realize that we are energy and we create energy every single day. I hope you like the presentation of Professor Vassilieva, Lyudmila, which is talk about that any pain, it is block of energy, your body talking to you, your body talking to you and complain actually to you. And in case if you use painkiller, you suppress the pain, but not the reason, and reason of pain still with you. We like to let everyone realize that body talking to us by body language, not by body posture, but by body language. And body language is not English, it's not Russian, it's not German, it is symptoms, signals, and sickness. It depends what we have capacity to understand, to hear, and to realize. In case we have signals and regularly, actively react on that, body adjusts and start to continue to support us to run life without any complaint. In case if we cannot realize sign as thirsty, as tiredness, as appetite simple, definitely body will send more stronger signal as symptoms. Symptoms, it's already pain, it's already vomiting, it's already lack of energy, advance, it's already cough, sneezing, whatever. Body still like to support us and trying to eliminate anything which is affected. It's trying to eliminate mucus by cough, by sneezing, and modern medicine considers it is allergy. But why allergy affects one and doesn't affect another member of family? They are from same genes. What's the problem? No, you are the one intolerant. You are the one cannot digest the food. But why my mother, my brother digests the same food and I cannot? Definitely everyone, modern medicine trying to support that something on charge, you are not. But actually it is your body who complain, or by pain, or by stiffness, or by vomiting, or by cough. And you are the one who's supposed to start to support yourself by supporting, release the reason, not suppressing the symptoms. And please, we welcome all questions related to pain, stiffness, related to any part of the body, because Professor Vassilieva can explain how by simple activity, simple action, simple exercise, or simple movement, or simple press can be support the body, not suppress, not ignore. Please, we welcome your question of any point related to signals, symptoms, or sickness to Professor Vassilieva. You can answer the question.
Так не отвечать? А кто-то продиктовал вопрос?
Thank you.
Thank you very much. Thank you very much. I want to answer your question, but it's necessary for me a special model of the skeleton because it's difficult to understand without model how it necessary use this balance of electromagnetism. Каждый раз, когда вы хотите проверить, как работает ваше тело, вы должны начинать с диагностики грудобрюшной диафрагмы. Вы должны поставить руки на нижние края ребер. И пропальпировать болезненные участки. Особенно в области мечевидного отростка. В середине грудной, где
Sensitivity towards the magnetic field.
попробуйте вдохнуть одной ноздрёй, закрыв половину носа, потом другой.
Then you try to breathe in by covering one nostril and then the other nostril.
Если боль и напряжение меняется по интенсивности,
if the pain intensity changes in case of tension,
вы можете себе помочь.
you can help yourself.
Необходимо совершать дыхание преимущественно одной ноздрёй, вторую зафиксировав.
But you can breathe with one nostril and you must press on the, you must hold your hand, you must hold your finger on the other nostril.
Но этой методикой не ограничивается вся возможность электромагнитной коррекции.
But that's not all methods that we can use to fix ourselves electromagnetically.
На последующих наших встречах мы будем говорить о более интересных методиках.
At our next conferences and next sessions, we're going to speak about more interesting techniques.
Следите за нашей рекламой.
You must follow our advertisements.
Просто очень важно понять, что электромагнетизм от того, что вы подышали одной ноздрёй, не будет стабильным.
You must understand that your electromagnetic state will not remain stable just because you have exhaled and inhaled using one nostril.
Обмен энергией – это большая часть адаптации организма к внешней среде.
The energy exchange is a big portion of adaptation of the human organism towards the environment.
И поэтому очень важно понять, что необходимо не только понять, что вы подвержены влиянию электромагнетизма, но изменить свою жизнь, свой образ мышления, свой образ питания, свой образ жизни.
So it's very important not just to understand that you are exposed to electromagnetics, but rather to change your diet and your way of life.
И только когда вы измените свой образ жизни, вы будете успешны.
And only when you change your lifestyle, you will be successful
В своем восстановлении здоровья.
in terms of how you restore your health.
Об этом будет говорить следующий докладчик нашей конференции.
And our next speaker will talk about that.
Have you any question?
Да, вопросы вот в чате есть. Нужно, я прочитаю сейчас тогда их по-русски, потом по-английски. Первый вопрос. Электромагнетизм – это отдельный лечебный процесс или его можно использовать в комплексе с другими кинезиологическими инструментами. Сейчас по-английски. Is electromagnetics a separate treatment process, or can it be integrated and used together with other tools of kinesiology?
Это может быть отдельный метод диагностики, и это может быть общий метод диагностики. Просто очень важно понять, что все, что в нашем теле происходит, оно происходит за счет энергии. И необходимо уметь ее как диагностировать, так и проводить, так и поддерживать.
It can be used separately, and it also can be used in combination with other methods. But we have to understand that our body works on energy, and we need to both diagnose it and to sustain it.
Просто очень важно понять, что есть кому продиагностировать для вас нарушение энергии. Есть специалисты, которые могут пролечить ваше нарушение электромагнитной энергии, но восстановить и поддержать свое здоровье вы можете только сами. В этом суть нашего выступления и нашего обращения к вам как к нашим единомышленникам.
It's very important to understand that there are experts, there are practitioners available who can help you diagnose and who can help you treat your energy status. But it's only you yourselves who can sustain it, who can support yourselves. And that is why we want to talk to you and want to reach out to you as like-minded people. Следующий, да? Тогда next question. I will read in Russian and in English. Then следующий, да, сейчас по-русски и по-английски. Там в следующем вопросе у нас две части. Значит, в кинезиологии мы проводим поиск пораженного органа при помощи магнита и уровня компрессии при помощи магнита. Почему мы так часто используем магнит как провокацию? Первая часть и вторая, какая связь между электромагнетизмом и неврологией. Сейчас по-английски прочитаю. In kinesiology, we search for the affected organ with the magnet, and we search for the severity. We try to diagnose the severity of nervous compression with the magnet as well. Why do we use the magnet as a challenge so often? What is the connection between electromagnetics and neurology?
Дело в том, что все процессы в организме проходят с участием электромагнитной энергии. И поэтому, располагая магнит над пораженными органами, мы всегда можем узнать, в каком из этих органов имеется нарушение электромагнитного процесса.
The thing is that all the processes in the human body happen with the involvement of the electromagnetic energy. And that's why by placing the magnet over the organs, we can see which organs are affected in terms of disturbance of the electromagnetic energy flow.
И заранее помочь пациенту предотвратить начало заболевания при помощи холистической медицины.
And we can help the patient prevent the onset of the disease using holistic medicine methods.
В этом наше предназначение. Поэтому, используя магнитное поле как провокатор, можно всегда найти нарушение электромагнитной энергии в любом из органов. А нервная система, она передает импульсы через электрическим током. И поэтому любое нарушение нервного проводника можно проверить при помощи электромагнитного прикосновения.
And that is how we can also restore the electromagnetic flow. And as regards the nervous system, it is this is what transfers the electromagnetic current through the body. And using the magnet, we can check, we can diagnose where the body has disturbances in the electromagnetic flow and help the body restore this balance and remove the disturbance.
В следующих наших выступлениях мы более подробно остановимся именно на этой теме, как электромагнетизм нарушается при компрессиях определенных нервов. И вы увидите, насколько важна энергия, ее поддержание, ее сохранение, ее развитие лично для вашего здоровья.
And in our next sessions, we're going to speak about how we can diagnose the disturbances in the flow of electromagnetic energy in case of compression, in case of a compromise of specific nerves, and how we can restore and sustain the energy for the sake of our own health. Так, следующий, да? Какие методы можно использовать для восстановления электромагнитного баланса самому себе? Next question is, what self-help methods can we use to restore the electromagnetic balance in ourselves?
Самое важное – это восстановить правильное дыхание. На сегодняшнем этапе, после нашей лекции, вы уже можете сами это сделать. Восстановить правильное дыхание правой и левой ноздрёй, включая коррекцию глазодвигательных мышц и проговаривая провокацию для правого и левого полушария. А в дальнейшем есть очень много методик, которые позволяют восстанавливать электромагнетизм, но мы о них поговорим в других семинарах.
Well, first of all, you need to restore the breath, and we have already shown you how to do that. You can breathe through the right nostril and through the left nostril, and at the same time you can use the eye movement muscles, and at the same time you can use the speech as the challenge. And there are also a lot of other methods that we're going to speak about in our next sessions, in our next classes. Так, сейчас есть еще вопросы по-английски в чате. Я сейчас их прочитаю тогда сначала по-английски, раз они так задавались, потом переведу на русский. So we have some questions in the chat, and I will read them aloud in English, and we'll translate them into Russian for Professor Vassilieva to answer. So the question from Rally Sebi, I'm sorry if I'm not reading correctly. So we unfortunately have only time for one question, and so this is the first the question that comes first. Hi, and thank you for an interesting conference. I have been having a tremendous pain on the upper back, left side. It keeps moving towards the left hand and down towards the heart. It goes on the neck, and that's it. As well as the head. It keeps changing, but pain is always present, sometimes more intense and sometimes just softer but annoying. Any advice, please? Значит, такой вопрос большой. Спасибо за интересную конференцию. У меня очень сильная боль в верхней части спины слева. Она с радиацией в левую руку и вниз в сторону сердца. И также идет радиация в шею и в сторону головы. И постоянно вот это вот местоположение меняется, но боль присутствует всегда, иногда сильнее, иногда мягче, но все равно раздражающая. Есть ли какой-то совет?
Уважаемые коллеги, наша конференция посвящена электромагнетизму. Мы сейчас не можем разбирать клинические случаи, но мы будем рады оказать вам консультативную услугу в нашем центре классической медицины в городе Дубае. Две прекрасные специалистки, Людмила Vassilieva, врач-гомеопат, и Людмила Vassilieva, врач-кинезиолог, готовы вам оказать услуги. Информация будет расположена ниже для вашего знакомства.
Well, the answer is as follows.